I'm more than happy to answer questions for you.
Can you take MS and GS
JS together?
JS together?
Yes, absolutely.
You can do that?
Yeah, we have a lot of people that do that. They love it.
Oh, I'm doing it right now.
Yeah, Mark is one of them. It's a lot of capsules, but you know, they love it. And they work very well together, synergistically.
You do have some claims. Do you have a clinical trial?
We don't claim to do clinical trials. Clinical trials cost a lot of money. We are not a drug company. We are not using these claims on advertising. This is just for educational purposes. So we don't claim that we have done randomized double-blind placebo-controlled trials because we're not marketing this product as a drug. So, you know, everything that I talked about today, this is just data, and I glean the data from pharmaceutical companies just as a way to help you understand. But we are not claiming that our product has these effects like the ones in the graph. And we're very careful with that. We want to be very careful not to overclaim and I think the word is hype, right? We're very careful to not overhype our products because I think a lot of companies out there are sometimes very unscrupulous and they make these exaggerated claims. So we try not to do that. The data that I shared with you, that's just our internal data. We're not going to publish that and say that those are random controlled trials because they're not. We don't claim that they are. Yeah.
You're mentioning that your product are registered.
No, it's so FDA does not register dietary supplements. It is produced in a FDA registered facility, and that's to assure the quality of the product.
But are you aware that in the Philippines you have to register the product?
As a dietary supplement?
Yes.
Yeah. I don't claim to know the rules and regulations of the Philippines. Yeah. I just recently became familiar with the Philippine community, so that's Mark's job.
Because in the Philippines, they usually, you have to register it even it's being claimed food supplement.
Oh, really? Now, does that fall under dietary supplements food, or does that come under drug? What is the category?
It's still food supplement.
Okay, but you still have to register it?
Yes.
Okay. Yeah. So that would be your job.
Part of licensing.
Yeah, yeah. I get that's part of the import process.
That's why I'm going to Davao.
Robyn, excuse me.
Yes.
Can we still taking your product? Can we still take the one the maintenance medicine?
Yeah. Yeah. So what we usually recommend is if you're diabetic and if you're on medication, start them together.
You can still
start them together.
Yeah, because this is only food
Yeah.
supplement, right?
So start them together. Usually at about the second week or third week, people slowly start to lower their prescription. And you know, we don't claim to be medical doctors, and we don't claim to be pharmacists, and we don't claim to tell you to do this or do that with your medication. I think it's very irresponsible, and we have to let you know, look, we're not pharmacists. Drugs are not part of our jurisdiction. Just like I don't expect a pharmacist to know a lot about herbal medicine, right? We have to be experts in the areas that we're experts in, and I am not a drug expert, but I can say, well, you know, it's up to you, but most people, what works for them is you start them together, and maybe after about the second or third week, you slowly want to reduce some of your medications. And most people do that on their own anyway, because they find that the less medicines they take and manage their diabetes, the better they feel. Now, one caveat, the type of people that respond really quickly with our MS product are insulin users. Those are the ones that respond quickly. If you use insulin,
the husband.
if you use insulin, Our MS product is a very good insulin sensitizer. That means it's going to make your insulin work even better. So we usually recommend keep an eye on it. If your sugar starts to come down, you kind of go down on your insulin a little bit. Yeah, we do recommend that you do that.
I have a question. If you're not diagnosed with diabetes, can this be taken as a
Oh,
preventive?
absolutely. That's a very, very good question. So remember the theme of the whole talk is diabetes is not high blood sugar.
So it
right?
can be taken as preventive measure.
Yeah. So some of the symptoms of hyperinsulinemia are weight gain, acne, you know, little pimples at that time during menstrual cycles, thinning of the hair.
But the dosage is still the same? It's
It'll be
two
the same.
capsules?
Yeah, it'll be the same. The thinning of the hair, you get irritable, anxious, insomnia, polycystic ovarian syndrome, women that have cysts on their ovaries, irregular periods. If you experience anything like that, that's actually a sign of hyperinsulinemia. You're on your way to diabetes. You know what's another sign? If you get sleepy after you eat,
Oh, yeah.
Yeah.
okay. I'm going to tell you another one that's going to surprise you. If you get sleepy after you eat, you are most likely pattern 2, 3, or 4. Probably pattern 4. And I can almost confidently say it based on the number of people that I've seen. So if you get sleepy, remember, because think about it. When you eat, food is energy, right? That means technically, it's like when your car is low on the gas and you fill it up, it should run better, right? Well, when you eat and you give your body energy, you should be able to feel better, right? Well, why are you sleepy then? Right? That's because of hyperinsulinemia. The high levels of insulin required to process what you just ate is causing you sleep, making you sleepy and tired. Because you're now going into energy storage mode. When insulin is high, your body goes into fat storage mode. When your insulin is low, your body goes into fat burning mode. And that's why those people that were treated with insulin, they ate less and still gained 20 pounds of fat. You see? So if you eat, and 20 minutes later you're falling asleep, and I'm saying that because I saw. If you eat and you fall, probably responding with a pattern 2, 3, and 4. Another classic symptom is if you skip a meal and you get irritable, and if you get shaky. Some people get that. They call it hypoglycemia. Okay? So if you skip a meal and you get shaky, you are on your way to diabetes. You're probably either pattern 2, 3, or 4, or already are diabetic. Okay? And there's a word for that. It's called hangry. You're so hungry that you become angry. Because think about it. Look how much fat we have in our body. The average human has enough fat stored in the body to last about a month to 6 weeks without eating, as long as you have water, right? So why is it that you skip one meal and your body starts to get shaky? What does that mean then, biologically? It means that because your insulin levels have been so high for so long, that your body is forgetting to tap into that fat. That's what it means. And your body is unable to burn fat for energy. So those are some of the signs. If you get sleepy after you eat, pattern 2, 3, 4. If you get shaky because you skip a meal, pattern 2, 3, and 4. If you get cravings for food, after dinner you get cravings for something salty, something sweet, that's pattern 2, 3, and 4. And most people find that when they take our Lucentam-S, they say, you know, Robyn, I don't have cravings anymore. I'm not craving like little chips and snacks anymore. Why do you think that is? I don't know. Well, it's probably because your body is using your fat. It's starting to see the fat and burning the fat for energy, And your brain's saying, no, 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 we're busy burning off this fat here, don't eat. And that's why they feel better, and that's why they lose weight. It's not a diet product, but it's a metabolic enhancement, so of course you're gonna lose weight. And you're gonna lose fat from the areas that you really, really wanna lose it, which is inside the liver, inside the pancreas, around your heart. Okay? Women really like our products because it makes their skin really, really soft. If your insulin is high, it keeps the collagen from becoming nice and fluffy and nice and malleable, and it actually makes the collagen fibers very hard. But once your insulin levels start to drop, your collagen starts to get really supple again, and that's why a lot of women like it. Another question?
Yes, if you are in the pre-diabetic states, is it safe to take the medicine?
Oh, absolutely. It's probably not safe. It's probably very, very advantageous, because when you're in that pre-diabetic stage, remember that graph I showed you? Right at about 5.5, your risk of developing heart disease does this, right? And so if you take the product at that stage, it'll probably help prevent you from becoming full-blown diabetic. Yeah.
Because I'm already
borderline.
Yeah. Yeah. So I am going to safely estimate that over half the people that I see on the clinic setting, they're pre-diabetic. Because they show the symptoms, and I ask them, and they say, oh, you know what, my doctor tested me, and they said that I'm just barely borderline. What's your A1C level? Oh, 5.7. And in my mind, oh no, this person's pattern 4, pattern 3, pattern 2. It's just a matter of time before they become, full-blown diabetic. And it's hard when you can see that and they don't listen to you. The really smart ones, they realize that they need to do something, so they take our products. The ideal A1C level, based on data, you want to be below 5.5. But you want to be below 5.5 without raising your insulin. That's the key. Your metabolic health depends on how well you can maintain your blood sugar by keeping your insulin low. But if you keep your insulin high and your blood sugar, your A1C is still 5.5, are you metabolically healthy? No, because you're pattern 2, 3, and 4. And you will be on your way to diabetes later. Any more questions? That's it? Yeah, we covered a lot of information here, so thank you for your patience. I know that there's a lot of technical information here. The joke in my family is that if you ask Robyn how to get somewhere, she will teach you how to build a car. That's the joke in my family. And so I tried really hard to keep it simple. To be honest with you, before I came, I had a stack of notes that I was going to refer to and read. And so I did a dry run at home before I left to my husband. I showed him the slides and I did my presentation. He looked up at me and he said, Robyn, get rid of those notes. I said, why? I need to tell them all of these things. And he said, Robyn, get rid of the notes, point the slides, look at your audience, and talk to them like you do with your patients. And that's what I tried to do today, so thank you.
Can we get a copy of it?
Sure, absolutely. Yeah, I will email.
I would like my husband to read that.
Yeah, I will email my slides in a PDF form because this is a keynote. It'll break your email if you try to download this. I will put it in a PDF form and then either email it or put it in a Dropbox and then send it to Zenny, and you can get that from her. Okay?
We get
It's important to show